I want to really appreciate everybody joining us today. As Franji mentioned, my name is Dr. Umair Shah. I'm the Secretary of Health for the great state of Washington, and it is my pleasure to join you this afternoon. I want to start by wishing all of you a happy new year. I hope you joined all of us in doing everything you could to be safe and healthy during the holidays as well as the past several weeks. I know what's on everyone's mind is COVID-19, and today's briefing will certainly focus on that. I will say, as the new Secretary of Health, I'm joining Washington at a very challenging time. I don't need to say that. I think you all know that. This pandemic has been very difficult for all of us. And while I remain focused on COVID-19 right now, next week I will be announcing my 100-day plan to focus on listening and learning from others across the state, as well as underscoring core values that instill health as a key driver of well-being for all of us as your next Secretary of Health. So I bring energy and enthusiasm to this discussion, building upon the work already accomplished at the department. But really today, the focus remains and will remain for many, many, many months on COVID-19. As you know, yesterday, Governor Inslee announced a new plan called Healthy Washington, the Roadmap to Recovery, that will go into effect on January 11th. The plan is just that. It's our roadmap to recovery. It will allow all of us to resume a small number of activities statewide and lays out the regional approach that we will all use to adjust restrictions when COVID-19 activity declines, and hopefully that it doesn't start back up. Our work is not done yet. We're seeing some signs, certainly, that disease growth is slowing or leveling off, and you're going to hear that from Dr. Lindquist shortly. But because disease activity has been so high during this third wave, we still need to see a dramatic decrease in transmission in order to continue moving forward with reopening. We're also making encouraging progress with distributing and administering COVID-19 vaccines. Michelle Roberts is going to provide an update on that. As of this morning, we have received 522,550 doses. That's 522,550 doses of vaccine that have already been delivered to the state of Washington, which includes allocations from both Pfizer and Moderna. Of that supply, providers have reported 126,602 total doses. It's 126,602 total doses of vaccine that's been administered since we began Phase 1A in mid-December. I want everybody to remember there's up to a 3-day lag in data reported to the state database, so the actual total number administered may even be higher today. Today, I'm pleased to announce, speaking of vaccines, that we are releasing our guidance phase of COVID-19 vaccination, which is Phase 1B. This is positive news because vaccines are our true roadmap to true recovery from this pandemic in our state. And while we're not ready to move yet to Phase 1B, the framework will help healthcare providers, communities, and people who will be eligible for the vaccine to plan ahead. Let me reiterate, we remain in 1A, Phase 1A today, and we also recognize that Phase 1B is something that everybody wants to plan for, and that's why we want to provide this guidance today. We have worked closely with the governor's office on this framework and have gathered feedback from nearly 20,000 people across the state who weighed in through focus groups, interviews, surveys over the past few months. The feedback we received from the public directly informed our recommendations and continues to help us make sure our vaccine plans are equitable and protect those at highest risk. Additional details are going to be available on our Department of Health website. We're also going to continue to make information available as we get closer to Phase 1B, and Michelle will be speaking about that, including a tool that's going to allow people to know which phase they're in. Later in the briefing, you'll hear more about our current vaccine numbers as well as efforts. But let me also say, I know that for some it feels like it's taking a long time to get vaccines into arms. You aren't alone in feeling this level of urgency. Public health and healthcare systems, and really all of us throughout the country, are facing the same challenges and timelines that you are. Like many other aspects of the COVID-19 response, vaccination at this scale and on this timeline is a first and involves a lot of complex planning and logistics. We're continuing to look at how we can speed up the process, and that is our number one priority, while we continue to work with our partners in the local public health, healthcare systems to identify solutions and improvements. And as we work to get more people vaccinated, all of our efforts to control the spread of the virus remain critical. That means make sure you follow the 3 W's: wash your hands, wear your mask, watch your distance, that you get tested, and certainly you do everything you can to avoid gatherings. All of these efforts are making a difference. We are seeing that, but we need to keep up this great work. So I want to also close before I turn it back over to Frangie, that yesterday in the governor's press conference, I made a comment, which is that we should not fear COVID-19, but we need to respect COVID-19. It has been a formidable foe against which all of us have been fighting around the country. And if we respect it, we will be best to be able to come out of this on top. If we lose sight of all the things that are going to be important to fight this pandemic, unfortunately, we may see what happens in other communities happen in our communities, and we don't want to see that happen. So thank you for everything you're doing. Happy New Year to you. And I'm very, very pleased that we're going to be announcing Phase 1B today. With that, Frangie, let me turn it back to you.
Thank you, Secretary Shaw. Next, we'll go to Assistant Secretary Michelle Roberts. Michelle, you should be able to share your slides.
Great, and thank you, everybody. I'm Michelle Roberts, leader of the State Vaccine Planning Group. I want to dive right into the details around Phase 1B right now, and I am going to show a slide to help us do that.
Well, we can see it. Go ahead.
Right, perfect. So here you can see the tiers for Phase 1B and our hopes for the corresponding timeline to get the vaccine to people. So Phase 1B includes four tiers of vaccine prioritization. Tier 1 includes 2 groups: all people age 70 and older, and people age 50 and older who live in multi-generational households. Tier 2 includes high-risk critical workers age 50 and older who work in congregate settings. So that means agricultural, food processing, grocery stores, K-12, schools, and so teachers and staff who are back in the classroom, childcare, corrections, prisons, jails, public transit, fire, and law enforcement. Tier 3 includes people 16 to 70 years old with 2 or more underlying conditions. And Tier 4 includes high-risk critical workers in congregate settings under age 50, so those same congregate settings as Tier 2, but bringing in everybody under age 50 years of age. And then Tier 4 also includes a second group of people, including people, staff, and volunteers of all ages in congregate living settings like correctional facilities, group homes for people with disabilities, and shelters for people experiencing homelessness. I want to talk a little more about our phases and how we made these decisions. We're following a federal framework, so that's like the Advisory Committee on Immunization Frameworks, and then using our community input and COVID clinical and epi data to decide on who to vaccinate in what order. These are really tough decisions. We wish there was vaccine right away for all. We have created these phases to make sure we are distributing vaccine in an equitable way to protect those in our state who are most at risk. We learned from the pandemic vaccine distribution in 2009, the H1N1 pandemic, that having multiple plans within a state is confusing and imbalanced. So we built on that lesson in our months of planning of talking to thousands of people in Washington state to come up with the state's plan. It would not be equitable or fair for each provider to choose their own order or who gets vaccine first. That's why the state has created the guidance with feedback from several partners and people in the communities across the state. Last week, we expanded Phase 1A to include more people and make sure providers who are going through the vaccine more quickly. As we work towards our goal in getting through phase 1A by late January, we ask for people's patience. I also want to just give you a couple updates on a couple upcoming launches in the next week or so. The first is a tool called Phase Finder. It's an online tool that will allow people to assess their eligibility for the COVID-19 vaccine. It's being tested now, and we plan to launch broadly the week of January 18th. Also next week, in partnership with Microsoft, DOH will introduce the new vaccine dashboard, which will be the state's main source for regular vaccine data reporting. The dashboard will include vaccine ordering and administration data, including breakdowns by county and by demographics. It should be updated 3 times a week. Look for the dashboard to launch next week. One reminder, and this is really important, although we are announcing phase 1B today, we are not starting phase 1B today. We need the time for planning and all of our on the ground healthcare providers to be ready. So we're asking all the people in the state of Washington who will be in phase 1B, although we know you're excited to get vaccine and we're excited to be able to get vaccine to you, please hold off in calling for an appointment until phase 1B goes into effect. We will share that information broadly when we are ready to move, but we're not there yet. This is all planning information for all of us to know what's coming next. We'll get there to phase 1B later in January. And right now, our vaccine providers are currently busy taking calls for and scheduling phase 1A vaccinations. And we need them to be able to focus on that in the short term. Thanks, and back to you, Corey.
Thank you, Assistant Secretary Roberts. Now we will go to Dr. Scott Lindquist. Dr. Lindquist, I'm making you a presenter now.
Okay, great. I will share my slides. Okay, here we go. Just let me know that you guys can see these.
Well, we can see them. Go ahead.
Okay. So I'm going to do this pretty quick because I will make no bones about it. I'm training you all to be epidemiologists. So you guys, your grasp of this every week is getting better and better. So you can go faster. But I'm still going to point out some unique findings in every week's data. This is just a reminder when we look at global cases of COVID, what our numbers look like. So 86 million. And again, I had given you a reference a couple of weeks ago about what is a large number of deaths from a pandemic. And you can see we're at 1.8 million here. Just putting it in perspective again, our flu, 1917 flu, or others are 40 to 50 million deaths. So it's not saying that COVID isn't important, it's just putting it in perspective historically for humans. So we're at 1.8 million global deaths. The majority of these are in the United States. The majority of cases are in the United States. The map shows that, the number shows that. This is nothing new. And again, the state is not uniform in the number of cases across the states or the hospitalizations. But this here, the darker the county, the more cases there are. And again, we're seeing this consistent pattern across the states. At the central region, Snohomish, King, Pierce are really remain high areas of case counts. And Yakima County, since the very beginning, has had a large number of case counts and remains in this area, along with Clark in the Portland metro area and Spokane on the border of Idaho. Remains the same, not a lot of change here from last week. I like the appearance of this, which is looking at case counts with specimen collection date. And you can see we have peaked on this third wave, which is way higher than any other wave, as Dr. Shaw pointed out. So we are still in a very high tenuous position. But the good news is we are seeing some flattening and some downward turn in the number of these case counts. And this is really the theme for this week, continued downturn in case counts. And that applies also to hospitalizations that I'll show you in a minute. One point here that I really want to just keep emphasizing with the lens of disparities here, that if you look at the Hispanic number of cases and the percent being 34%, comparing that to the percent of Washington population, the Hispanic population or Latinx population is disproportionately affected. And we need to keep an eye on this as we're trying to combat this COVID infection. There's a couple ways to look at hospitalizations. It's a really intricate issue that I look at several different data sources. One of these is this hospitalization count. The gray areas are where the data are not complete, but again, we are seeing this third wave with a flattening and downward trend. This is all very positive. Another way of looking at this is through the WA Health COVID-19 admissions. And just to get a little more intricate here, we do see this large increase. And we saw several dips with spikes, dip and spike post-holiday. That's what these represent. But overall, our most recent data is showing, again, with WA Health admissions, a downward trend. All this coming together. And yet another way of looking at this is looking at COVID-like illness and the hospitalizations associated with it. Two important trends here I want to point out. One of those is that we are seeing a flattening and a downward trend, again, in this hospitalization by COVID-like illness. But more importantly, we're seeing a big difference still between hospitalization rates for these two colored graphs, the blue and the kind of pink purple, which is the younger age groups. Much lower hospitalization rates for COVID-like illness than the older populations, and the dotted line here is the average or the overall trend for the state. Again, very promising. It's stalled out. It is not continuing to go up. It is stalled, flattened, and going downwards. So all very good news. And with that, Frangie, I'll turn it back to you after I unshare here.
Thank you, Dr. Lindquist. Next, we'll go to Dr. Mosseth.
Hi, everybody. Good afternoon. Can you all hear me okay? All right.
Yes, we can hear you.
Great, thank you. Now that that vaccine is rolling out, you heard Michelle Roberts talk about the need for patience, and that's really important right now. And it's very difficult from a behavioral health perspective because of how people are feeling. So I want to provide a few tips today on how we can cultivate patience intentionally. It's clearly something that is in short supply for many people, but it is also one of the most valuable assets that we can bring to bear on our experience over the next couple months. So a really important core value for sure. We can become more aware of the emotions that are making it hard for us to wait, that kind of pressure us. And those include things like loneliness and depression, or anger and fear, things that many of us are feeling very strongly right now. And those strong emotions make it hard to be patient and test the resilience that we've been working on building up. So as I mentioned last week, we can also focus on increasing resilience by fostering connection, hope, purpose, and then becoming flexible and adaptive during stressful situations and times. And developing resilience is important for all of us, but it's particularly something that we're concerned about for teens and young adults right now. It's really essential for them. As a clinician, I talk to teens and young adults and families, parents regularly, and they're really feeling the effects of the length of this and how it's affecting all of the different aspects of their lives. And the stresses associated are really bringing them down. They're having a hard time. Many of my students are also sharing the experiences and the difficulties that they're having. So if you know a young adult or a teenager and can reach out to them and check in, please do that. We can share information with them about how normal it is to be struggling, whether that's emotionally, like having a really short temper or snapping at people, or cognitively, that's something most people are struggling with, difficulty remembering things, difficulty tracking information. We can help support them by giving that information to normalize their experience, and then also by doing active listening. So active listening is something that really helps. It's not about trying to problem solve. It's about listening to somebody with the intention of understanding their experience and their concerns and expressing care towards them. It's incredibly effective. It doesn't feel like it's very concrete, so it's hard for people to sort of understand, but it's really an effective tool that we have. It's probably one of the most valuable behavioral health interventions that anybody can provide. So strong advocacy for active listening. Getting involved with community recovery efforts is also really helpful with regard to patience and resilience, because it gives you a direction and something to focus your energy on rather than just waiting. So for example, people of all ages, right, can either help start a community garden, pick up trash and debris, organize activities for younger kids and peers, or help neighbors and contribute to the community by offering to do grocery shopping or even to do delivery for them if they're licensed drivers. If you want to learn more about supporting well-being for kids and teens, you can check out the website, the coronavirus.wa.gov/wellbeing website, and then scroll down to where it says children and teens, and look at the Behavioral Health Toolbox for Families. That's a multi-page resource document that our team created. It has all kinds of tips and guidance in there for how parents can best support really kids of all ages right now. So that's about it for me. Thanks very much.
All right, thank you, Dr. Moseth. And now this brings us to the Q&A segment of today's briefing. We do have several media with questions today, and so we won't be able to get to follow-up questions today, but if we're not able to get to your questions, please reach out to us at doh-pio@doh.wa.gov. So now, to begin our media Q&A portion, we'll start with Ariel Dreher from the Spokesman Review.
Great, thank you. My question is, how are at-home care workers who provide the lion's share of long-term care in our state going to get vaccinated in phase 1A? Sort of whose responsibility is it to ensure that they're offered the vaccine, in this first phase if they're not necessarily attached to a big healthcare provider?
Really? Go ahead, Dr. Shah.
Let me start, and then Michelle, I'll turn it to you for more specifics. Great question. One of the things that we're doing is we're also, and the governor mentioned this yesterday as well, that we're having discussions with our hospital and healthcare partners as well as our public health partners. And one of the things that we're asking our hospitals to also do is to help take on not just those workers that are part of their own system, but also other healthcare workers. And so that is something that we've asked them to do, and they have been very supportive of being able to do that. There are obviously some logistical challenges that they're working through in order to make that happen, but we are very hopeful that working with our healthcare and hospital partners will be able to address that. And Michelle, you have some specifics about the specific question that she asked.
Yeah, I'll just add that we completely are working to find a place for everybody who's eligible in 1A to get a vaccine. And we're really, like Dr. Shaw said, working with our community partners on that, helping health systems and clinics get the infrastructure stood up to vaccinate people outside of their system. Our tool, the Face Finder, will help, is what we're building out to help link individual eligible people to a place to get vaccinated. So that's being built out right now to make that linkage a lot easier. We're also supporting local health partners really in planning to kind of continue to assess the gaps. Specifically for the home health community, we're working with DSHS and the unions that support these staff and license these staff to make sure we're communicating that information directly to them as we work to increase the number of sites they can go to get vaccinated.
All right, thank you. Our next question comes from Daniel Walters with the Inlander.
Yeah, I'm wondering what are the barriers that you're seeing right now in terms of getting people vaccinated more quickly? Well, what are the things in the way, and how are you trying to topple those?
Yeah, let me start again, and and I know Lacey's turned her camera on, so she might have a comment as well, as Michelle. But what I would say is, there are a number of barriers or impediments. One is, as I mentioned earlier, it's not ideal when you get a new program that started right before the end of the year, which is exactly what happened. But it is what it is, right? I mean, we move on. I mean, that's the case, and we're now into 2021, and we've just got to move past that, and here we are. There are also challenges when it comes to it is easier for healthcare systems, particularly hospitals, to be able to vaccinate their own workers. It becomes more challenging when they're now trying to vaccinate those healthcare workers or others who are not within their system. The other piece of this is really about long-term care facilities. The program that the federal government had put in place with the pharmacies did not get started or initiated until December 28th. But that said, there's also the piece, and I use the comment or the hashtag of don't hesitate, vaccinate. And what that really entails is that when it's time to get vaccinated, don't hesitate about it. One, that we vaccinate and there's no hesitation there, but number two is that you receive the vaccination. And that's really important as we're seeing the reports, for example, out of LA County and other places around the country, including in Washington, where there are healthcare workers who are on the front lines and are actually hesitating getting vaccine. Well, that's a significant issue as well. So there are a number of different factors. Obviously, logistics are also in the mix, but I do think at the end of the day, we are making improved progress here. And Michelle didn't provide this information, and maybe she can in her answer, but it does appear that we have picked up the pace for the vaccination as well, which is also really important to see. So again, it's not how we start, it's really how do we continue to progress and move forward in a more expedient fashion.
Great. I'll just add into what Dr. Shaw said. I mean, I think he covered it well. DOH's commitment is to saving lives and working to ensure vaccine is available to all over time in Washington who want it. So we need to increase vaccine access in our state. That's absolutely clear. But we are proud of that every day more vaccine is getting into the arms of people here in Washington. But I think you remember the first few days of kind of week one, we were seeing numbers come in kind of start to trickle a couple hundred, and then we were getting into the thousands. Those numbers, the rate of vaccination is increasing over time, and between yesterday till today, we had the highest one-day increase ever, and that was 16,000 new doses coming into the state in a one-day period, in a 24-hour period. So we're really excited to see that rate of growth about the number of vaccines that are coming in every day. We think it's more important measure than looking at the percentage of people vaccinated. That's going to change the actual percentage each day based on how much vaccine is coming into the state. We have chapters every day, and based on the number of people getting vaccinated. Like Dr. Shaw said, we are seeing the pace of vaccine administration increase. I also just want to say, there was a lot of unique circumstances that made the first few weeks challenging, such as the holidays, unpredictable delivery schedule, and really the time needed at that local level for the extensive planning to scale up these large-scale campaigns. And vaccination events, and for health systems to be able to vaccinate people easily outside of their own system. And that's exactly what's happening right now. And we will see the pace of vaccine continue to increase.
All right, thank you. Our next question comes from Carolyn Bick with the South Seattle Emerald. Go ahead, Carolyn.
Great, thank you so much. So I spoke with the healthcare provider who spoke with other healthcare providers, and he's not technically part of phase A. And this is where things start to break down because there seems to be a lack of clear communication from the DOH. He said that he and other healthcare providers who don't work directly in hospitals have been told on a broad scale that they're ineligible for the first round of vaccines, but learned via word of mouth that they actually can get vaccinated. They called vaccination hotlines like Kaiser to confirm this and subsequently book vaccinations. And so my question is, why were they told they couldn't when all this time they could have been scheduling themselves to get the vaccine? And given this, who is actually eligible for the vaccine? As it doesn't appear that there's a clear picture internally, even at the DOH.
Well, I would. Thanks for that, Carolyn. I do think there's the clear picture within DOH, and I do think that there has also been a transition. If you remember last week, we announced that we were expanding the 1A to be all healthcare workers. Previously, it was healthcare workers who are at highest risk, and as well as the long-term care facility residents and staff. We did a press briefing just like this, actually exactly 1 week ago, and we made that announcement that we were opening up 1A to all healthcare workers. Now, that doesn't mean that every healthcare worker is going to get that message. And so I do agree with you that we have to continue to champion additional ways to communicate. And that's where all of you as our media partners can help us, right? So it's not just the 1B information that Michelle laid out. Obviously, just yesterday with the Roadmap to Recovery, the extension of 1A last week, anything that you all can do to help us get that information out would be helpful. From a DOH standpoint, we shared that actually the extension to all healthcare workers in 1A to our healthcare partners last week. Again, it was actually even prior to the announcement. So now why a healthcare system may get that information somewhere in the system and it doesn't get all the way to the person who picks up the phone, who answers the question for a healthcare provider, that obviously I can't answer. But I will say that as a physician myself, who has gone through extensive numbers of different emergencies over the honestly decade and a half, I will tell you that this is par for the course. It happens, and communication is the #1 challenge that we have in any response. And so we will continue to do better. We'll continue to do whatever we can to champion optimal communication. Where we do not have it right, we will get it right. But I do think that we within DOH are aware of what 1A is. We have communicated that with our partners, and certainly we're hopeful that our partners will make sure their frontline persons, their personnel who are answering the phones, are also aware of that information. Thank you. Michelle or Lacey, anything to follow up? Thanks. Frangie?
All right, our next question comes from Anna Boyko-Wyrock with KUOW.
Hi there. Thanks very much. So DOH has said that Walgreens and CVS would begin vaccination clinics the week of the 28th, and that the facilities would get calls to schedule the clinics the week before that. But I've been talking to facilities, and facilities are saying that they're only just hearing from the pharmacies this week, and they won't actually have vaccination clinic dates for 2 more weeks until mid to end of January. Can you help elucidate what is the holdup? Why is it taking so long for long-term care facilities in this program to get vaccinated?
Well, what we're
Michelle,
really working on is, yeah, I can start. The federal program is a great gift because they're handling all the logistics and everything to get with CVS and Walgreens. But they, just like all of our other healthcare providers, are working through the startup of that program. When we've talked previously about the start of the program and scheduling visits, I just think everybody needs to understand they're working through the groups of people who are registered. That's over 2,400 facilities. So all those home calls to schedule and get visits can't happen on the same day or the same week. So we worked with Walgreens and CVS to prioritize the skilled nursing facilities. So that's the types of long-term care facilities that need the highest level of care, where people are the sickest and most at risk. and that's where they started. It has been a slower start than I think ideally we all want to see. I think all of this is coming from, we want to get vaccine to those people who are most at risk, and those facilities are definitely one of the places. So we're working regularly with the federal government, with CVS and Walgreens to really look at the pace and to figure out what can we do to increase it. I just also want to share, there's a lot of really unique challenges in vaccinating at long-term care facilities, especially skilled nursing facilities, that are different than really a mass vaccination clinic or what may be able to happen at an employee clinic. So just the pace they can work through the patients there is very different. They often have to go room by room, which is a very much slower pace than it is having employees who can show up at a specific time or potentially stand in line in a socially distanced way. So that is one of the drivers, is logistically, it does take time to get all the work scheduled, and then it takes time in the facilities to make sure we're really following standard of care, which is what is happening, to deliver those vaccines to every individual in the facility.
All right, thank you. Our next question comes from Tom Bonzi with Public Radio Olympia.
Hi, thank you. Question for Ms. Roberts. I'm looking at the phased rollout of the vaccine and comparing it to the CDC Advisory Committee. And at least to my eye, it looks very different. A lot of different cutoffs on the ages and discussion about high risk rather than just essential workers. I'm wondering if you can talk a little bit more about what caused you to make so many changes from what the guidelines that came down from the feds last month.
Well, to be clear, the guideline from the feds, and the feds have said that is always a guideline and a starting place. They included very broad categories that was probably up to around 4 million people in our state. They were very clear that states and jurisdictions are going to have to narrow within those groups, because unfortunately there's just not enough vaccine yet. There was a lot of debate in the actual meeting for that about what the right age cutoffs were, how were equity concerns being taken into consideration, where was the risk. And so they were looking at those pieces, which led into their broad recommendations. And then we needed to narrow as a state and also relook at that data we had about what is our community input, where do we feel like the risk is. So that's why we tried to go down in the beginning. It's kind of a combination of what our 1B is of what CDC put out as kind of a 1B and 1C, because we really wanted to decrease the age to lower levels, feeling like, and this is something the federal government, the committee debated, 75 is a pretty high age to start with. We're going to be missing groups, especially racial and ethnic groups, that maybe have lower life expectancies. We also really wanted to look at those multi-generational households, especially for families that are caring for elders in their home. That was really an inequity with 1A, just focusing on vaccination to people who are in long-term care facilities. We know many families take care of their elders in their home, and we want to make sure we're reaching those families as well to protect those most at risk. And that is one of the pieces of input we've heard from our community partners, and an example of how we're really using our community input to guide our decisions. Dr. Shaw, do you want to add anything?
The only thing, maybe pivoting just a moment from that, Michelle, I think you answered the question great, is that, I think the key message today is that we remain in 1A as a state and vaccinations continue. We're announcing, and we're pleased to announce today that we here's 1B, and we're not there yet, but here's 1B and where we're planning to be, so people, including community members and partners, can plan for when it starts to be their place in the queue. We also recognize that we're also hearing from some of our communities that may be closer than others to complete 1A, and they may be getting closer to get to 1B. While we think it's going to be probably a few weeks before we get to 1B as a state, there may be a community or a region that says we're closer, and we're asking those communities or those regions to contact Department of Health so we can actually help look at their situation and see if there's anything else that we can help support, and or whether it's okay to move into 1B for that community. But again, we remain in 1A, and the reason that we want to be very careful about this is that you've also seen, while everybody wants vaccines to be out as quickly as possible, and so do we, we've also seen that if it's not done methodically and carefully, some of the stories across the country that have been equally challenging on the other end, which is about people overwhelming systems or folks that are waiting in lines for vaccines, and potentially putting those individuals at risk while they're waiting to get vaccinated. That's also something we're weighing and we're balancing. So we want to do everything we can, recognizing that during this pandemic, there are trade-offs to everything, and there are difficult decisions, and no one recognizes that more than all the individuals that are now facing those either decisions or impacted by those decisions. But we're doing everything we can to work with our partners in our communities so we can get vaccines, not just into the state, but into the arms of people as quickly as possible. So I just wanted to add that, Michelle, and Frangie, we'll turn it back to you.
All right, thank you. Our next question comes from Evan Bush with the Seattle Times.
Yeah, I was wondering if you all could provide a breakdown for how many doses have been delivered to long-term care facilities and how many doses have been administered in those facilities, as well as to hospitals and other providers. Just trying to understand what the difference in pace is. The governor had mentioned yesterday that that he was more enthusiastic about the pace of vaccination in hospitals after seeing some data from the Washington State Hospital Association. So trying to get a finer understanding of what the data says and suggests.
Michelle, do you want to?
Yeah. You want me to start? So we've had, as of today, or earlier this morning, around 522,550 doses delivered to Washington. That does include, that number includes a set aside for what's going to long-term care program. Both some long-term care vaccinations happening directly in our state, and then a set aside to CVS and Walgreens. So the CVS and Walgreens set aside is about 96,000 doses. So it's a significant amount. And one of the challenges, we are working to get to the answer through our data around how many vaccines have been given directly to long-term care. And part of that is we have to really find new ways to parse apart our data. Because it's all coming in as doses given, and we need to be able to, we're working to distinguish the long-term care data from the other doses data. And also I'll say the data from CVS and Walgreens, although we're setting aside vaccine for that from our allocation, CVS and Walgreens report directly to the feds first, and then that data comes back to us. And that's because it just is easier for CVS and Walgreens when they're operating in every state to report directly to the feds first, but it does include a little bit of lag for us getting in there. So we're working to get those specific numbers ironed out, but kind of at a high level, 522,000 around in our state, including around 100,000 for long-term care. And then as of today, we have had, actually as of 11:59 last night, we had 126,602 doses given to Washingtonians. And so that would include, largely that's coming from the healthcare system, but there are likely some doses to long-term care mixed in there.
All right, thank you. Our next question comes from Michelle Esteban with Como.
Oh, thanks very much. Hi, guys. It's certainly clear that you want as much of the vaccine to get out as soon as possible. But can you help understand why we didn't have a plan sooner to ensure higher vaccination rates? I get that it's a huge priority, especially, in light of when you look at other states. If I'm doing the math right, the number of doses over 522,000 and 126,000 administered, that's only 24% of what we've got. When you compare it to other states are doing better. So is there a specific reason why we're lagging? I get that it's new, but I'd like to know why we didn't have a better plan to ensure higher vaccinations rates, number one. And then number two, with regard to tier 2 and phase 1A, I'm talking to a lot of people who are really having trouble finding places to get vaccinated. They want to get vaccinated, but it's difficult to find. For example, call a PCP and then call a county and then jump to another county. Thank you.
You want me to start,
Michelle?
Doctor? Yeah.
Yeah, I'll just make a comment that, you know, I guess I would just take exception to the fact that that, you know, the comment that was made was really about there are states that have done better. I would also say there are states that have done worse. That's, I mean, it is what it is. The point isn't the comparison across states. And again, remember, I'm coming from a different state. So I've arrived, or I'm arriving from a different state. And I can tell you there are challenges across the country. I talked to fellow health officers, health commissioners from other states just this morning. There are conversations that are happening across the states on the health side and across localities on the health side, and everybody is having challenges. So I think it's not maybe as helpful to do this comparison across states, because every state is different. We recognize that there are some states, especially the ones that have maybe smaller states or more relations, they may be further ahead. But I think it's the fact that it's not, the question was about not having a plan or a good enough plan. I think it's really not about the plan. It's about really how do we work through all the pieces and the logistics of a very complex plan. And so then the follow-up is, well, then make it a simple plan. But it's not that easy to make it simple when we're really dealing with health, we're dealing with vaccines, and we're dealing with human beings. And it's not, it is something that all of us are going to have to recognize. And I think Dr. Massett said this, that there's this word of patience. We don't mean patience as in wait forever, but what we mean is patience to really recognize that the system really does take time. It takes time whenever, you know, I've seen it even when you have a new medication that's just being launched. It takes time for people to even accept that medication. It's a new initiative on a new child health initiative. It takes time. Things need to work out. And this is obviously a completely different proposition with the pandemic that we're all facing. So I just wanted to make those quick comments as a overarching. And then Michelle, if you want to address the specifics of the second tier of 1A.
Yeah, we are sorry, Dr. Shaw, what was the second question? The second tier?
Yeah.
Or can you repeat that?
Right. Second tier of 1A, people maybe having trouble trying to figure out how they can go about getting vaccinated.
Exactly. So we are, like I shared earlier, working very aggressively right now to do a number of things. We are working with local health and healthcare systems and healthcare system leaders to address where the gaps are, and working on removing barriers as much as we can, the logistical barriers to getting, helping health systems vaccinate those gaps, and then being able to do it, bring people into the system. And we're also working on how do we get vaccine to more places to address the gaps. So that is an active conversation. We've done a soft launch of our Phase Finder tool that really is helping screen for eligibility, and then ideally linking people to a site to get vaccinated. We're working on building up the detail from all those health systems into that one location about how to schedule, where those appointments are, when they're available. So those are the details we're working on. We know everybody is anxious and ready. And I'll say, just for a broader perspective, I mean, Dr. Shaw mentioned pieces of this, but you know, we really started started our planning with official guidance from the federal government in the middle of September. And we are so glad it's such a gift that we had vaccine by the middle of December. But we started really with the number one place where in day-to-day world where the immunization infrastructure is in our healthcare system. And that is the most important place to start. But if we could do a comparison, you know, we vaccinate, you know, 50 to 55% of our population for flu vaccine over a 9-month period. So we are working to do something that's incredibly unprecedented and really hard for all of us. We're all, you know, this is, you know, nervous about our families, wanting to protect our families and our loved ones. And vaccine's a gift to be able to do that. But it is a huge launch and a huge challenge to be able to develop the infrastructure that's way more than what we do in a normal flu season to be able to make sure vaccine's available to everyone who wants it. So we understand why people are ready and anxious, and we are working to fill those gaps in. That's what we're identifying and what we're working to solve to make sure we can get vaccine right now to everybody who's eligible in 1A.
All right, thank you. And this concludes the question and answer segment of our briefing. And now we'll go to Secretary Shaw for closing remarks.
Well, I just want to thank everybody again. I want to thank our team at Department of Health, all of our partners, certainly our media partners, and most importantly, our community members across Washington. It is a very difficult time, not just because of everything that out and experiencing related to the pandemic, but also because we see the light at the end of this long tunnel, which is vaccines, and things have not gone across the country as we had all thought they were going to go. And that means that there's a lot of work still to be done. But we are committed to doing that work. We're going to do it as quickly as we can. We're working with the governor and his team, and our number one priority remains fighting this pandemic and certainly making sure we get vaccines into the arms of as many Washingtonians as quickly as possible. Please be patient, but also remember in the meantime, the 3 W's: wash your hands, wear your mask, watch your distance, but also get tested. And remember that in the meantime, if you have not gotten your flu shot, this would also be a time to get your flu shot as well. So there are some things that you can do as well to help us, but at the same time, we want to do everything we can to help our state get through this pandemic as quickly as possible. And I just want to thank everybody for all your hard work. And we are on the road to recovery. It's just going to take time because it's a long road. Thank you.